We are starting, ma'am. Am I audible? Am I audible? Yes, ma'am.
Yes, you are audible.
Yes, ma'am. We are starting. We are streaming live on YouTube. Dr. Sheetal, ma'am, are you there?
Yes, ma'am. Yes, I am available here.
The session. I'm opening the session for the public participants.
Yes.
Good afternoon to one and all. Myself, Dr. Neha Singh Mandade. I am the host for today's webinar on behalf of IAP Digital Media team. And also, I am the district coordinator of Indian Association of Physiotherapists Women Cell, Latur district, Maharashtra. We are here for a series of webinar that we will be conducting on the consecutive Saturdays of this month of August. So, on behalf of IAP Digital Media team, I would like to introduce a very warm welcome to all the participants. I, Dr. Neha Singh Mandade, from IAP Digital Media team, I will be hosting for today's webinar, which is we have two guest speakers with us today. The topics are, first, the topic is breastfeeding, myths, facts, and ergonomics from a physiotherapist perspective, which will be spoken by and taken by Dr. Manisha Rathi ma'am. And our second guest speaker for today is Dr. Nupur Kulkarni ma'am. The topic for her presentation would be role of physiotherapist in breast engorgement. The Indian Association of Physiotherapists is the oldest and largest association representing physiotherapists in India since 1955. The IAP Digital Media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms, that is Facebook, Instagram, Twitter, LinkedIn, and YouTube. Follow us on the IAP profiles on all these social media to receive notifications for our events such as webinars, workshops, CMEs, conferences, health camps, blood donation drive, and to know more about recent updates on physiotherapy. Subscribe to the IAP India YouTube channel for notifications of all our live webinars. In the playlist section on this channel webinars, there are segregated into various folders on the topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer rehab, etc. for the easy access. And the social media links will be shared in the chat shortly. So now to start with today's webinar series, I welcome you all. And I will now call upon Dr. Sheetal Ghule Fard ma'am, who is along with my team. She is the district sub-coordinator of IAP Women's Cell Latur. Sheetal ma'am, over to you to start with the introduction and then the guest lecture. Thank you.
Yeah, ma'am. I welcome you, Dr. Manisha Rathi ma'am, and good afternoon, everyone. I, Dr. Sheetal Ghule Ford, as a sub-coordinator of Latur district IAPWC team, on the behalf of IAPWC Maharashtra team. So I welcome you, Manisha ma'am. Ma'am is a professor and principal at Khyati College of Physiotherapy, Kalodia, and adjunct professor at D.Y. Patil College of Physiotherapy, Pimpri, Pune. Her professional experience is 6 years, including teaching experiences of 24 years and a half. Yes, ma'am is member of IFP, Indian Association of Physiotherapists, as well as she is the state council of member of state council for the physiotherapy, state council of Gujarat. She has completed her PhD in physiotherapy in allied health sciences for the DY Patil from DY Patil College, DY Patil Vidyapit Pune, and her master in physiotherapy in general community. And
You're audible, ma'am. You may continue.
yes, ma'am. Ma'am has completed her master in physiotherapy in general and community based physiotherapy rehabilitation in 2007 from the 2007 and bachelor in physiotherapy from the Physiotherapy School and Center of Government Medical College, Nagpur in 1995. She also has completed certificate course on yoga from the University of Pune and certificate course on the education leadership and certificate course on the enhancing soft skill and personality. So ma'am is received many awards and recognition in including service to the profession award at first Women's Health Conference IAP at and she also achieved the award of significance achiever awards at the MS Physiocon conference in 2020. So national physiotherapy conference. So ma'am's got the best faculty award at Rashtriya Shiksha Ratan Award at national television, as well as she approached to national television channel Doordarshan Sahyadri to discuss on yoga and Swastha Health, part 2 on the program of on the program of Mahacharcha. Ma'am is also she has 2 patent and 3 copyright published to her credit. She has presented many research paper in national as well as international level and was also invited as a resource person at many of the conferences and seminars. She has contributed in 4 books as an author and reviewers. She has more than 80 publications to her credit in various databases, including Scopus, Web of Science, PubMed, and UGC Peer Journal. I welcome you, ma'am, and now hand over the session to you, ma'am.
Thank you, Dr. Sheetal. First of all, I would like to congratulate Dr. Neha, Dr. Sheetal, and entire Women's Cell Latur branch, IAP Latur branch team for organizing this webinar and this series also, as you said. So it is a wonderful work you people are doing for the benefit of women's health. And thank you for inviting me on this platform and allowing me to express my words, my views to the community as well as for the physiotherapist. Thank you so much, Dr. Neha, Dr. Sheetal. Kindly allow me to share my PPT. Is it visible?
Yes, ma'am.
Okay. So for me today, I have got the topic breastfeeding myths, facts, and ergonomics. So basically, the world is celebrating this breastfeeding week. Why there is a need to celebrate this week or to spread the awareness about the breastfeed? Because still there are many areas, many countries which lacks the awareness about the breastfeeding and its importance, and that's why there is still a need to uh, to spread maximum awareness related to the breastfeeding. And this year, the theme for this breastfeeding week is closing the gap, breastfeeding support for all. Now, what kind of support every female is expecting who is breastfeed? This support includes mainly the policies and attitudes that value women and breastfeeding. There should be certain policies to be made at the government level, the NGOs level, which helps the women who breastfeed. So that should be in favor of them. Then there should be certain decisions to be made related to the women and the breastfeeding friendly healthcare system. Certain policies, certain things should be developed. So there should be a friendly healthcare delivery system related to breastfeed. Then support, again, support for the women who we should respect their autonomy, their rights for the breastfeed. They can breastfeed anytime and anywhere, and that's why there should be certain policies, something, certain support should be developed with this respect also. And to overall this value the women who is breastfeeding, we need a community support. Is not only a personal, if the policies are made or the attitude we are developing, but then community support, the support from family, support from workplace, support from her own husband, support from the community is not there, then this all the breastfeeding awareness efforts will go in vain. And that's why there has to be a combined support from all the people, so that this breastfeeding awareness will be spreading to the maximum people. To spread the awareness, we should understand what are the various barriers which develops for the prevention of healthy breastfeeding. There are individual barriers, there are practitioner barriers, and there are societal barriers also. There are generally, what happens if the cesarean section has been done, then immediately for 12 hours, for 24 hours, in some areas even 48 hours, babies are not given to the mother because they feel that she needs some rest, she's under anesthesia effect, so baby should not be given to the mother in this particular time. So this is one major barrier which has been seen, especially in case of cesarean mothers. The cesarean section birth has been done. So this barrier we must understand and work for the prevention or overcome this barrier. Then individual factor में there is lactation problems. Now आता lactation problem क्या होता है कि अगर फीमेल ब्रेस्ट फीड नहीं कर पा रही है, उसको उतना मिल्क प्रोडक्शन नहीं हो रहा है, या शी इज गेटिंग इरिटेटेड बिकॉज ऑफ द improper positioning, because of the musculoskeletal problem she is developing, and all this combines and result in the inadequate blood supply. Agar inadequate milk supply, if inadequate milk supply is there, then her child become cranky, that child will continuously cry, and that will further irritate the mother. So this barrier is there, which a lactation counselor or a healthcare professional must understand this barrier and overcome for the betterment of that particular female. Then there is an inadequately trained healthcare related staff who is trained specially in case of breastfeeding. So there are certain areas where this particular staff is not there. In nowadays, lactational counselors are available, but still they are there in certain areas only. There are remote areas, unreached areas are available where these inadequately trained staffs are still not, they are not available. So there is a problem. This is a practitioner barrier. Then there is unnecessary use of infant formula feed due to commercial influence of babies food industry on the health facilities. Now what is happening, if, as I earlier said, there is a lactation problem, then immediately that mother or the relatives, the family members, they will say that no, baby is not getting enough milk, so you don't now feed the baby, we will go for the infant formula feed, because they know, they have seen many commercial ads also that how it is effective and all, and they immediately shift to the infant formula feed instead of making the female, that new mother, understand what is the her problem, and taking her to the lactation counselor and understanding the entire problem she is facing. Before that, they will immediately shift to the infant formula feed, which is again a main barrier for establishing a healthy breastfeed relationship with the mother and the baby. Then inadequate counseling and support to mother during antenatal and immediate postnatal periods. There are many areas where antenatal classes are still not uh, there available, or even certain areas where the mothers are not understanding the how to hold the baby, or how to hold the baby for 15 minutes 20 minutes during the breastfeed, or even during antenatal period they have been explained all the theory part, that how the baby should be hold, how this, what are the various positions, when, but it is all the theory part, and there's some demonstrations also been given. But when actually it comes to the baby, her baby, she is very much possessive, she is having that fear that how I am going to hold the baby, and if I can hold with more pressure, that baby may be getting hurted, and that's how she is not completely comfortable in holding the baby, taking the baby to her breast and all. And that's why this inadequate support, inadequate counsel during the antenatal period, immediate postnatal period becomes the barrier. And that's why role of family members, the healthcare professional, is very crucial at this point. Then mothers return to work if they are working, that fear or stress will be continuously there in their mind, that yes, I have to go for work, how I will manage, how my baby will get the feed and all. And that stress will lead to the reduction in the lactation. So that stress should be reduced by support, giving the support of by the working environment. Then any trauma or any psychological issues during the pregnancy or during the birth phase, during the labor pain, that also causes problems to the new mothers. And embarrassment or lack of adequate infrastructure for the feeding mothers, if they are going, suppose कोई मदर बेबी के साथ बाहर गई है और वहां पे उनको एनवायरनमेंट नहीं मिल रहा है, या कुछ एम्बेरसमेंट फील हो रहा है कि हाउ कैन आई फीड द बेबी हियर इन फ्रंट ऑफ सो मेनी पीपल, or I go to the side room, then also people must be watching me what she is doing there and all. And this type of barrier she is feeling. There is a lack of even though right now also many places there is lack of infrastructure available, that feeding rooms are not available, and that overall becomes the barrier for the healthy breastfeeding. Now, to overcome all this, as I said earlier, family support is the crucial part for the establishment of healthy breastfeeding. Family support, husband support, then the healthcare professional support, the gynecologist support, even the lactation counselor support, everything is important to establish a healthy breastfeeding process. So, from the family, what we expect is emotional support, providing knowledge about the breastfeeding and giving adequate rest time, and reduces the undue stress on her. This will help in establishing a healthy environment in the family, that will make a new mother a strong emotional support, that will get a small emotional support which will help in establishing a good relation with her baby and with her, so that there will be a more and more healthy breast feeding process going on. Even family can help in identifying whether baby is sucking properly, feeding well, baby is crying or not. In the family, especially the female members of the family, they can find out whether baby is sucking properly, baby is taking the feed properly. After feeding, baby is sleeping properly, nicely for some time or not. Baby is playing, baby is laughing or not properly. That all these observations they can do, and they can help the new mother for establishing the healthy breastfeed. Then even they can identify, family members can check the crack nipples are there, signs of breast engorgement is there, any painful tenderness is the in the breast is there or not, nipples are protracted or all properly retracted is there. So they should find out, if the nipples are retracted, they will not be able to feed the baby properly. So they can find out all these things, and either they can take the new mother to the proper healthcare professionals, or they can also support in the other ways. Even identify whether milk production and infant's demand is matching or not. Whether milk production is too less and infant is crying continuously or not, supporting baby is getting cranky or not. That also should be observed. If it is less milk production, then what are the methods for increasing the breast milk production? That should be taken care. Even baby should be continuously given to the mothers in case of less milk production is there, because the lactation reflex or letdown reflex is there, which helps in production of more and more milk in the mother. So that should identify by the family members and can help the mother. Even the father's emotional support is very important for the newborn baby. If baby is there, mother only cannot do the all household task or child care task. If father is also helping the mother, that helps in reducing stress from the mother's side, and it will help in developing a healthy relationship between all the family members. Father can assist in the difficulties which are there for the during the breastfeed. They can support also mother properly and help in establishing the nice breastfeed process. Even if the family member find that she's having more and more milk production, it should not go in the waste. They should donate excess milk to the human milk bank wherever they are available. They are right now available in certain cities, they are not available everywhere, but wherever they are available they can donate the milk, human milk, which can be stored at room temperature for 4 hours, in the refrigerator for 4 days, and in the deep freezer for 6 months to 12 months also. So even if she is going out and she's feeling that she's expressing milk that which is excess milk, and baby is not there to give the breastfeed, then she can just express the milk and keep it in outside in the room temperature with proper hygienic condition, and then whenever the baby is there again, she can feed the baby with the same milk. But duration of the expression of milk should be taken care. It should not be excess, otherwise it may cause any unhygienic conditions. Then there are many research also which has been done, which says how family support is important in improving the overall breastfeeding process and the behavior of the mother, behavior of the newborn child for taking the maximum milk. If lack of family support is there, then the breastfeeding process will be, there will be a major hindrance for this behavior, and that's why family support is extremely important in this process. Then support for the working mother. सपोज शी इज वर्किंग, उसको बाहर जाना पड़ रहा है, काम के लिए जाना पड़ रहा है, और एनवायरनमेंट ऐसा नहीं है कि जो न्यू मदर को सपोर्ट कर पाए, देन वो काम के लिए बाहर जाने के लिए बिल्कुल भी राजी नहीं होगी, और शी विल बी कंटिन्यूसली अंडर स्ट्रेस कि what the my how I will feed my baby for these many 8 to 10 hours. So this should be taken care by the working environment people, or the HR personnel of any company, or by her supervisors, by her colleagues. So they should support to these newborn mothers. Now how they can support? They can help in normalizing the breastfeeding behavior of the mother. If earlier she was feeding every 2 hours, 3 hours to the baby at the workplace also, she can get some breaks in between for the feeds, so she can establish or maintain that normalized behavior of her breastfeeding. Then she at workplace they can provide her clean proper space to nurse and pump, uh, so that she can pump the breast milk in, and that should be in the public areas. So proper enough space, enough hygienic place should be there. It should be clean environment, and it should be secure, privacy should be there, that care should be taken by the working environment. Then make lactation consultant available whenever possible. If you feel that she is having some problem in the breastfeed, then the lactation consultant can be available over there. That arrangements can be done by the working people itself. Then end the week to week schedule for the mothers, these new mothers who joined recently. For them, you should not give end to week to week schedule that you must do this work, that work, and all. Give some space, give some time to them to readjust in this new environment. Then allow breastfeeding moms to go get back to work on a part-time basis. This also can be done. Then hospitals should provide more help to these mothers. If they are working in health hospitals and all, then they should provide more help. Then there should be some babysitting and rooms available there. Baby crèche should be available in the campus. Then consider her baby issues and provide adequate support in terms of leaves, duties, work pattern. So in this way, working people can give support to these mothers. And again, as I said, repeatedly said, that lactational counselor plays a huge role in maintaining a normal lactation process. If any problem is facing by a new mother, then she must go to the lactation counselor, because they identifies the problems. They help in minimizing the barriers which are facing by this particular mother, and maximize the success of the breastfeeding. And there are many studies which are available where the role of lactational consultants are important. Then coming to the main topic of this, that is myths about breastfeeding. There are many myths and facts about the breastfeeding. The very important initial myths are: breastfeeding is easy and natural for all mothers. Yes, it is easy, but in the beginning, for the first time who is becoming mother, it is not easy. For them it is really difficult, because how to hold the baby, how to go for the latching, how to feed the baby, how to sit for continuously for 10 minutes, 15 minutes. And this is not a one time task कि just once breastfeed हो गया and over. It is days together, months together, sometimes to 1 year, 2 years also. So breastfeeding is not easy to sit continuously, to breastfeed in a day for 4 to 5 times, 8 times, 9 times, for 10 to 15 minutes, and to see whether the feeding, baby is taking proper feed or not. So all this is difficult in the beginning stage, but once you develop a healthy relationship with your baby, and the latching is proper, then it, yes, it is easy and natural. Then there is again one myth that it is usual for breastfeeding, during breastfeeding, that it hurts breast or sore nipples are occurring. No, it is not every time it is happening. If the baby is not taking the feed properly, and baby is biting the nipples, then there is a hurt to the breast, or the sucking is not proper, the latching process is not developed properly, then there is sore nipple develops, that leads to hurting the breast and sore nipple. That's why education related to how to latching was exactly what it is, and how to hold the baby properly in proper position is important. Then one myth, still it is following in rural areas, that honey and jaggery should be given to the baby immediately after birth, before giving the breast milk. And then after some time, maybe after 4 hours, 5 hours, breast milk should be given. And the first milk, what colostrum, we say that should be not given to the baby. So these are all myths. Never give anything outside um, thing to the baby. Immediately after the birth, you can give breast milk to the baby. And the first milk, which is known as colostrum, is very healthy for the baby. Then separate a newborn and the mother, so that mother should get enough rest. Mother should get enough rest, that's true. Mother should be resting properly in the few days of her delivery, in the initial postpartum period. But that doesn't mean that you should separate the baby from the mother and give her rest. She can rest with the baby also, there is no issue for giving her rest, enough rest, without the baby. Then there, a mother should eat plain food while breastfeeding. It is not like this. Plain food is food should be given which is nutritious. This is what is very important. Nutritious food which has all content: proteins, carbohydrates, vitamins, minerals, everything, lipids, everything is there in the food that should be given to the mother. If you don't give enough nutritious diet, the she will not be able to make her baby healthy via breastfeed. So she should not eat only plain food, she should eat nutritious food. That is very important. And then still some myths are there that if you do exercise during the breastfeeding period, then that will affect the taste of the breast milk. That is all myths. Exercise doesn't affect any taste of the breast milk. Exercise will make her healthy, make her the mother healthy, which will help in further healthy relationship, good psychological relationship with the baby. So it is all completely myth. Then breastfeeding leads to breast to sag. It prevents pregnancy and hence feed the baby continuously. Breastfeed doesn't allow the breast to sag. There are many reasons other than the breastfeed. There are many reasons where breast sags. Breast weight is decreasing, age is advancing. Then there are strength of the muscles which is reducing around the breast. So that all leads to the sagging of the breast. Is not only the breastfeeding which leads to sagging of the breast. And yes, to some extent it is true that pregnancy will be prevented while baby is getting fed, but no, is not 100% sure, because pregnancy can occur when you are feeding the baby. So it is completely myth that it prevents pregnancy completely. Then formula feeding is just as good as breastfeeding, as I already told you earlier also. Formula feeding, yes, the mother which is not completely lactating and she's not able to feed the baby at all, for them formula feed should be given. But for the mother who is properly breastfeeding, you should not allow the formula feed to give for the baby, because it's not as nutritious as breastfeeding. Breastfeeding, the milk which is coming from the breast has all antibiotic properties, all immunities boosting properties, which the formula feeding may lack. That's why it is not replacing the breastfeeding, but yes, to some extent, okay, in certain cases where breastfeeding is not at all possible, then you shouldn't breastfeed when you are sick. It depends on the sickness of the mother, what type of sickness she is having, plus what type of medication she is taking. It all depends on that. A simple sickness of fever she is having cold and cough, then she should not stop the breastfeeding. So it depends on the type of illness she is having, severity of the illness she is having, and then consult a gynecologist before stopping the breastfeed, and then only you decide whether it should be stopped or it should continue. Then babies who have breastfeed are clingy. Certain babies are clingy, not all. And breastfeed doesn't say that all the babies who are on breastfeed will be clingy. No, it all depends on the baby itself. So this is all myths that baby will become clingy if you continuously breastfeed. No. Then if you go back to work, then you need to wean the baby from the breast milk. No, as I already said, there are many areas, working areas available where you can feed the baby. Your relatives can support to take the baby to your workplace. You can feed them there, then they can again take back, give the support. So that type of things can be possible. There is no need to wean the baby from the breast milk before going to the work. One more myth is there that breastfeed cannot be done if you have small breast. Breastfeed doesn't depend on the size of the breast. Yes, if the nipple has any problem, then baby cannot suck properly. That is a different issue. But small breast, large breast, it is not related to that. It depends on how your ducts are filled with the milk. It all depends on that only, how your lactation reflex is working, how oxytocin is releasing in the body. It all depends on that. So it's not related to the size of the breast. So even small breast female can feed the baby enough. So these are all about the myths of the breastfeeding. Then facts. What are the various facts which are uh, there for related to the breast milk or breastfeeding? As we all are aware, breastfeeding benefits the mother and baby. अगर mother ने breastfeed continuously किया है for 1 year, for 2 years also they can do, then there are many problems which she is not going to develop, like there is postpartum depression she will not develop if she feed the baby properly. There are studies which says that diabetes will not be developed, hypertension will not be developed. So these conditions, there are many cancers which will not be developed, like ovarian cancer or breast cancer, which will not be developed if she breastfeed properly. So there are benefits for the mother also, and definitely for the baby. Yes, baby is completely depend on the breastfeed in the initial months. As soon as baby is born, baby look for the breast for the feed, and that's why there are many benefits for the baby. Baby gets immunity from the breast milk, baby gets enough nutrition, enough calcium for the growth of the baby. All the enough nutrition whatever is needed to the baby is through the breastfeed. So baby will also not fall sick frequently if immunity is developed. So breastfeed benefits both mother and baby. Then first milk, as I already told, colostrum must be given to the baby because it is rich in antibiotics and it boosts the immunity, and it helps in developing the immunity of the baby, newborn baby. Then exclusive breastfeeding should be done for the first 6 months. And then you can continue for 1 year with the top food. You can continue for 2 years also with the top food. There is no problem. But initial 6 months, there should be exclusive breastfeeding. There is nothing on the top should be given to the baby. It may lead to lots of unhygienic condition, because whenever you feed from the outside utensils or outside product, that can spread the infection to the baby. That's why, to avoid all these infection, unhygienic condition for the baby, exclusively feed the baby for 6 months. Yes, breastfeed burns calories. Generally, during pregnancy, almost 3.5 kg to 4 kg fat weight is increased in the mother. That fat weight is enough for the breastfeed. Now generally what happens, since the mother is breastfeeding, she is eating a lot because nutritious food she should have, but overeating should not be done, which will help in increasing her weight. But if she exclusively breastfeed with a proper diet, yes, definitely she is going to burn calories, she is going to shed her weight which she gained during fat weight which she gained during her pregnancy. Then breast milk adopts the baby's needs. As we all are aware, फोर मिल्क जो पहले से जब बेबी सकिंग चालू करता है मिल्क लेना, तो फोर मिल्क जो आता है वो थिन होता है, जो शुरू का मिल्क होता है वो थिन होता है, और फिर बाद में वो थिक बनते जाता है, फैट कंटेंट और उसमें ऐड होते जाता है. सो ब्रेस्ट मिल्क changes the consistency from the initial time to the later time, and that's why you should not feed the baby only in the first 1 or 2 minutes from one breast or then later to the other breast. You give them enough milk from one breast first so that the fat content milk also should be sucking by the baby. So and milk adopts according to the baby's needs, and breastfeeding reduces the risk of sudden infant death syndrome. As I already told you, baby's health will be beneficial. Then coming to the ergonomics while breastfeeding, yes, we all are aware that there are very much important ergonomic advice a mother should follow so that she will minimize her musculoskeletal problems, her different aches and pains in the baby, in the body. So be comfortable, adopt a comfortable positioning while feeding the baby. Use pillows or cushions to support back, arms, and the baby. You put the pillow first and then put the baby on that, so that you don't have to lean forward on the baby. Baby will come up and you don't have to bend forward so much that will lead to your neck pain, upper back pain. So common breastfeeding positions are, you can see here, cradle hold position, cross cradle hold position, football hold position, and sideline position. Sideline position should not be given much time because it may lead to some problems in the baby while feeding. So because nose can be choked up due to the breast weight and all, that can lead to problems. So best position is the cradle hold position, which maximum time a female should adopt. Then the other ergonomic advice is maintain a proper latching. Now, what is proper latching? Proper latching will prevent nipple pain and effective way of milk transfer will occur. Here, baby's mouth should cover the maximum areola of the nipple, okay, more from the below area than the above, and their lips should be flanked outwards. So they should be, you can see in the picture, their nose should not be compressed, their chin should be downwards properly, areola should be completely in the mouth of the baby, more of the lower part than the upper part. Nose should be free so that baby can take breathe properly. In this way, proper latching is occurring, baby will suck effectively properly in short period of time. They can take the maximum milk also. Avoid leaning forward, this I already told you, so that you will not develop upper back pain and low back pain also. Then switch the breast, alternate breast during feeding. Ensure that even milk production and prevent discomfort from the engorgement. Only don't feed from one breast at a time. You use both the breast, but enough time should be given for both the breast, so that foremilk and hand milk also should be given to the baby. If you feed only from one breast and the other breast is not emptied properly, then there are chances of engorgement will occur. Then engorgement, you know that the topic will be taken care by the next speaker. Then take breaks, frequent breaks, which will help in adjusting the position, and use supportive chair. You can use supportive chair or the comfortable armrest chair for the breastfeeding, so that you will be comfortable enough. Then ergonomic breastfeeding training. There are many studies which have done on this, that how ergonomic helps in proper feeding, proper breastfeeding, as well as minimizing the discomfort to the mothers. And researchers has said yes, it is helpful to some extent, even for the infants also it is helpful, and mothers definitely, in terms of reducing the musculoskeletal disorders. Proper positioning also helps in overuse of lumbar muscles and helps in minimizing the incidences of upper and lower back pain muscles. Studies has been done which has been done that biomechanical analysis while doing the breastfeed, they have put the EMG electrodes on various muscles and found out, and it has been observed that if in a proper positioning, musculoskeletal work will be reducing, whereas in default positioning there is overuse of the muscle, which may lead to back pain. So this is all about the myths, facts, and ergonomics. If you have any questions, please.
Hello, ma'am.
Yes.
Amazing lecture. After very long that we are listening and hearing to you, and the valuable knowledge that you have been giving, like delivering to all of us. Thank you so much. Ma'am, there are a couple of questions that we will discuss right now. Shall I go
Yes.
ahead?
Yes, no problem.
Ma'am, few questions are amongst them. First is, what are the health benefits of breastfeeding?
Health benefits to the mother. There
To
are
the
many. Yeah, mother, as I said already, breast cancer, ovarian cancer will be prevented from the proper breastfeeding. If you breastfeed for 6 months, for a year, depends on your baby's needs, then the chances of these cancer will be reducing. Then studies has been done which says that chances of uh, hypertension or diabetes will be reduced. Chances of postpartum depression will be also reducing in the mother, and even excess weight which has been gained, fat weight which gained during pregnancy, that will also shed off with the proper breastfeeding. So these are the benefits to the mother.
Okay, thank you, ma'am. Next question. How do I know if breastfeeding will work for me or not? Meaning, sometimes there are queries from the mother side. Will the breastfeeding work for both of us, only for me or only for the child? So, on what basis should we decide that?
Whether it is proper or not.
Yes, whether the breastfeeding is going to work for me as well as for my mother, because
Yes.
that is point of decision for a working or for a homemaker person with that.
Yes. So for in terms of baby, if we see if proper breastfeeding is working, is enough breastfeeding, the milk is going, then you can see the growth of the baby properly. All milestones will be going at proper time. The weight of the baby will be increasing at regular interval. That can be monitored. Even the height of the baby can be increased. So this growth and milestones, the social smile and all this will also be developed. So that can be especially the weight of the baby is the major criteria where we can say yes, breastfeeding is going on properly. So this is the major for the baby. And for mother, she can see that there is no breast engorgement she is seeing. There is no breast problems, soreness in the breast or tenderness in the breast is seeing. Then you can say that proper breastfeeding is going on.
Okay. And further question, like that is from one of the chats that we have received. Like after delivery, nipples are blocked. Many people say to express the nipple immediately after delivery so that the pores will be opened up for the milk. How true is it?
Yeah, these nursing staffs are there. There are stages of the retracted nipple. So if the nipple is retracted, then it is necessary to take it out. Otherwise, the baby will not be able to suck the milk. And in the beginning stage, with the help of the healthcare providers, you can express the initial milk and open the pore so that the ducts opening will be opened up properly, so sucking will be easy in the that stage. And if it is retracted, then there are many equipments available which helps in protruding the nipples.
Okay, thank you, ma'am. Can I breastfeed if the baby is born preterm? Is the next question.
Yes, preterm baby, there is no problem. Breast milk, breastfeeding can be done. But if the baby is in NICU, the preterm is not with you, then you can express the milk, you can store also properly, and you can give that milk to the baby. So there is no proper direct breastfeeding. As soon as the baby is allowed to take towards you, then you can. If it is in NICU, other expressed milk can be given.
Okay, ma'am, can you also highlight upon the kangaroo care that ideally is being provided at the higher centers, but that may not be a point to be noted on the in the primary care centers? Like, how do you promote more of kangaroo care?
Yes. Basic concept of kangaroo care is to develop a strong bonding between the baby and the mother, which will help in, like I said, let down reflex is there. As soon as the baby is attached to mother or baby's touch or baby's, when a mother is seeing her newborn baby, that time the lactation reflex, the let down reflex releases oxytocin at the higher center, which helps in production of more and more milk to the in the breast. So and that will definitely help in healthy bonding between the baby and the mother, and more breast milk will also be produced, so growth of the baby will also be enhancing. So especially in case of new preterm babies, this kangaroo care is very very essential.
Yes, ma'am. Further question is, does breastfeeding hurt? I think this will be more for the next topic. But yes, ma'am, your views on this.
I can see one
Uh,
question here. Immediately post cesarean, what position do we advise? Okay. Immediately post cesarean, since mother cannot sit and give the cradle position or cross cradle position, immediately with all proper care, sideline position is okay. But with proper care, that baby's nose will not be pressed. And in the for 2 3 days till the mother is comfortable in sitting and feeding the baby, you can go for sideline position. Later on, switch to cradle position.
Yes, ma'am, there is one more question. Any specific suggestions do you give during antenatal visits to the gynec? Like from a physiotherapist point of view, do we need
In
to?
the antenatal period, yes, mothers should be understanding that the would-be mother should understand that what type of how the baby should be held, and how the actually practical demonstration should be given by the gynecologist, by the healthcare professionals, by the physiotherapist who are conducting the antenatal classes, that how exactly the mother should will be holding the baby while the breastfeed, and all the myths should be clear at that time itself. That type of, if the counseling is done pre, it will definitely help in postnatal period.
Yes, and ma'am, like how often is the breastfeeding that ideally should be given to the babies? Like, what are the signs that you should understand that whether the baby's tummy is full? Because very commonly the people say that the baby is crying and the baby's stomach is not full, that is not sufficient. So these are the things that the mothers get to listen.
Yes, yes, very, very nice question and very commonly asked. Yes, generally what says that every 2 hours baby should be feeding the baby, mother should feed the baby, and there are plus few more signs like, as you said, crying. If the 2 hours are over but still baby is sleeping, then don't wait that baby should get or cry and then only you feed the baby. You can feed immediately after 2 hours also, because baby doesn't understand in the beginning period that he's hungry or not, and then when extreme hunger is developing, that time baby start crying, and then there will be rebelling nature develop, that they will not take the feed in the beginning and all. So that happens, that is through experiences I can say this. So generally every 2 hours you should feed the baby, and yes, you should observe how the baby is reacting, how much playful baby is, his activity is reducing, you can definitely feel that yes, he is hungry, you should give him feed.
Okay. And ma'am, as a physiotherapist, how can we help these breastfeeding mothers and how often should they visit us during their ANC and during postnatal period?
Yes, very nice question. These mothers, generally, what problems, once they delivered, they will not at all turn up to the any doctors for visit, or maybe just for vaccination, or extreme cases they develop any problem, they turn up. But I prefer that every week or even 15 days that come up to the physiotherapist, show them what exercises they are doing, because in the beginning when they are hospitalized, we are giving them exercises, we are showing what is to be done. So that counseling, that exercise they should perform at home, and if possible every week once, or every 15 days at least, they should visit to a physiotherapist, show what exercises they are doing, how they are feeding, is the feeding position appropriate or not. They should not wait to develop any musculoskeletal problem and then come up to a physiotherapist. Okay, so they should do exercise in between and visit the therapist. Even some abdomen problems, core muscle problems also develops because of the abdominal weakness, core muscle weakness. So back pain will also be developing. So that will also be taken care along with this breastfeeding care.
Okay. Uh, yes, ma'am. I think we are done with the chat box and other queries. Thank you so much, ma'am, for adding us all your inputs on today's webinar. Thank you so much.
Thank you. Thank you very much for inviting and giving me opportunity to speak with you all. Thank you so much.
Our pleasure, ma'am. Thank you. I shall, ma'am, stay with us. We have our
Yes.
next speaker with us. I would request Dr. Sheetal ma'am to introduce Dr. Nupur Kulkarni ma'am for the next webinar. Thank you, ma'am. Over to you, Sheetal ma'am.
Thank you, Neha ma'am. So, hi, Dr. Sheetal. I welcome you, Dr. Nupur Kulkarni ma'am, on the behalf of IPWC Maharashtra team. So, ma'am is completed her Master of Physiotherapy and PhD in Community Physiotherapy. She is working as professor and HOD in Department of Community Physiotherapy at RJS COPT College. As well as she has experience of 12 years of experience, and she is certified in Otago exercise program leader from the UK, as well as she have fellowship in geriatric rehabilitation, as well as she has awardee of European Union funded Erasmus UFRATS scholarship for PhD research in Greece, as well as ma'am is contributed in author of books and chapters in various physiotherapy books, as well as she has 34 publication and 7 copyrights, and she is reviewer and associate editor of various national and international journals, and she is coordinator of research and collaboration committee. So I welcome you, Nupur Kulkarni ma'am, and now hand over the station to Dr. Nupur Kulkarni ma'am. So she will insight about the role of physiotherapist in breast engorgement. Welcome you, ma'am.
Very good afternoon, everyone. First of all, I would like to thank the organizers, Dr. Neha, Dr. Sheetal, whole IIPWC Latur team and IIPWC Maharashtra and India team for giving me an opportunity to interact with you all. And I also welcome all the participants who are would-be moms, who are newly mom, and those who are caregivers of those moms, as well as physiotherapy students and professionals. As our first speaker has rightly said, that breastfeeding is important for a mother as well as baby. So this is a very important topic of breastfeeding. But there are some issues which are faced by breastfeeding moms. So breast engorgement is one of the commonest issues faced by them. So what is this breast engorgement? So breast engorgement is a condition which is occurring due to excessive production of milk.
Hey, ma'am, sorry. Ma'am,
Yes.
if you put the presentation on slide share mode.
Yeah, is it visible?
The slide is visible, ma'am. You can just start with the slide
Yeah,
presentation.
sorry. Yeah. Is it fine now?
Yes, thank you.
Yeah. So this is a condition which is occurring due to excessive production of milk, sometimes obstructions in the outflow of the milk, poor intake of milk by the baby, and it is usually manifesting after 3 to 4 days of the delivery. As we have in our participants, we have new moms also or would be moms also. I'll simply tell that कि अपने बॉडी में जब मिल्क प्रोडक्शन होता है तो बेबी की डिमांड और मिल्क सप्लाई इसमें थोड़ा मिसमैच इनिशियली हो सकता है. जब मिल्क प्रोडक्शन स्टार्ट होता है और बेबी पूरी तरह से मिल्क सक नहीं कर रहा है, या जब ऑब्स्ट्रक्शन हो जाता है, जहां से मिल्क ग्लैंड से जो मिल्क सिक्रेट होता है उसमें ऑब्स्ट्रक्शन होता है, तब भी एंगोर्जमेंट ये कंडीशन हो सकती है. और यूजुअली डिलीवरी के 3 से 4 दिन बाद ये कॉमनली पाया जाता है. So what are the symptoms of breast engorgement? If you can see on this slide, this is how a engorged breast looks like. So there is a swelling, warmth is felt if you touch it, वो हल्का सा गर्म लगेगा, tenderness will be there, it will be painful, nipple will become edematous, areola will be hard, and the veins will be clearly seen and prominent over the breast. Sometimes the females, if this breast engorgement is present for a longer time, low grade fever will be there. There will be generalized malaise. Swollen and tender lymph nodes may be seen in armpits of some females, and there will be pain on feeding the baby. So even if this breastfeeding process is very important for a mother as well as baby, it will be very difficult for a mother to feed the baby, and through the engorged breast, even it is difficult for a baby to suck it. So in symptoms, if the new moms observe these signs, that is swelling, ब्रेस्ट देखने के बाद ही आपको पता चलेगा कि वहां पे स्वेलिंग है, ब्रेस्ट थोड़े कड़क हो चुके हैं, देयर विल बी सम हार्डनेस एंड टेंडरनेस विल बी देयर, मतलब टच करने के बाद वहां पे पेन होगा, इवन निपल्स पे भी स्वेलिंग हो सकती है, और वहां का टेम्परेचर ज्यादा होगा. तो ये ब्रेस्ट एंगोर्जमेंट की साइंस है, ये हम समझ सकते हैं. Now, what are the causes of this breast engorgement? So first and commonest cause is rushed feeding. Rushed feeding means whenever the baby starts crying, sometimes new moms, they don't understand. So sometimes we are if it is the first time we are experiencing the motherhood, whenever the baby cries, immediately we put baby over there, and when baby stops sucking, we take out और वी स्टॉप द ब्रेस्ट फीडिंग, तो तब क्या हो सकता है कि इनकम्प्लीट एम्प्टाइंग ऑफ ब्रेस्ट हो सकता है. इनकम्प्लीट मीन्स द प्रोडक्ट produced milk will not be expressed completely and it will remain in the breast and which will clog the milk producing glands. तो ये एक रीजन है. दूसरा है मिस्ड फीड्स. कभी कभी मतलब बेबी सो जाता है तो हम लोग को लगता है कि ठीक है, वाई टू डिस्टर्ब दी बेबी. समटाइम्स बेबी स्लीप्स मोर देन 2 3 4 hours. So as our previous speaker has rightly said, too early breastfeeding is usually advisable, and too early breastfeeding is good for mother as well as baby. But sometimes if baby keeps on sleeping continuously, the feeding slot is missed. So in that case the engorgement can occur, or pumping is not properly done, baby is not able to suck properly. और कभी कभी प्रीलैक्टल फ्लूइड्स में बॉटल फीड भी दिया जाता है. sometimes mothers are not able to secrete the milk, so in that case they start with bottle feed or formula feed. Formula feed is advised in order to prevent dehydration or malnutrition in the baby. But if it is continuing, the baby the sucking procedure or the breastfeeding is not so effective in babies if they depend on bottle feeds. Then poor latching or poor feeding technique in which the mother is not comfortable while feeding, or poor latching means ideal latching procedure, the baby should suck with the help of areola. A complete areola should be there, and then nipple cracking will be avoided. So अगर वो टेक्निक नहीं फॉलो होती है तो ब्रेस्ट एंगोजमेंट हो सकता है. Wearing too tight clothing, because sometimes females feels that their breasts are sagging. To prevent that sagging or the increased weight of breast accommodate करने के लिए tight inner garments पहने जाते हैं, like tight brassiers. So that may also lead to clogging. कैरिंग समथिंग हेवी ऑन दैट साइड, मतलब अगर हम लोग वो साइड से इवन बेबी को उठाते हैं या कोई वेट उठाते हैं, सो दैट विल कंप्रेस द टिश्यूज अंडरलाइंग द ब्रेस्ट एंड दैट मे फॉर्म द एंगोजमेंट. Next, another thing is nipple bleb or milk bleb. So in this picture you can see that there is a thin white membrane which forms the block over that. So that block is nothing but a means after lactation there is a clogging of milk gland and that may lead to engorgement. So these are the common causes: incomplete emptying or rush feeding, missing feedings, bottle feed, poor latch or poor feeding technique, wearing too tight clothing, carrying something heavy, and formation of nipple bleb. Now, why is it important to discuss about breast engorgement? Because if the breast engorgement is not prevented, so that may lead to some complications, like there can be mastitis, inflammation of the breast. There can be inflammation further leading to infection over the breast. There can be fever. Some signs of mastitis are there will be raised temperature, there will be pain and malaise, and in further cases it may lead to bacterial infection जिसमें antibiotic देने की जरूरत पड़ सकती है. So whenever the mother is feeding the baby, the and means antibiotics will not be good for the mother. So it's always better to prevent these kinds of condition. So how to prevent this? Definitely breast engorgement is preventable if you initiate the breastfeeding early. So kangaroo mother care always helps the female to feed the baby and to secrete the lactation as early as possible. So after kangaroo mother care, initiate the breastfeeding at the earliest so that even baby becomes accustomed for sucking, and the mother starts lactation as early as possible. Then avoid prelactal feeds. Prelactal feeds are only given in case where the female is not able to secrete the milk. So if first give a try about breastfeed, and then means you can decide if prelactal feeds can be avoided, so that will be good for the baby as well as mother, as prelactal feeds may increase the risk of dependency on that. And exclusive breastfeeding has been advised as a natural means it has got lot of antibodies and it is healthier for the baby to develop a good immunity. So always encourage breastfeeding. Then feed the baby at frequent interval. Frequent interval means 2 hourly is advisable. So every 2 hourly, even if the baby is sleeping, or even if the baby doesn't demand, but on the clock you can check if 2 hours are over, you can start feeding the baby, so that whatever milk production has taken place, that will be expressed and that will be utilized by the baby. Then whenever you are feeling that breasts are hard and overfilled, start gently massaging the breast and express the milk. And whenever you are starting with the breastfeed, before that try to soften the nipples, so that it will be easier for the baby to suck through that. Then feed the baby in correct position. Correct position means a mother should be sitting in a proper position, as we have seen cradle hold, cross cradle hold, football hold, or side lying. So whatever is the comfortable position, because no single position is ideal while breastfeeding. So you can change the positions in between, so that even your body gets rest. And in that position, make sure that baby is latching properly, baby's nose is not closed, and baby is getting good amount of milk through breastfeeding. But in some certain cases, this prevention is not possible and it may lead to breast engorgement. So what to do? So a physiotherapist plays an important role in the females who are having breast engorgement. So first of all, a physiotherapist is supposed to do the proper assessment. After history taking, in assessment, physiotherapist is supposed to check the signs and symptoms. Symptoms are reported by the patient, and signs which we check on the patient. After that, measure the core body temperature and breast temperature, that can be measured using a non-contact infrared thermometer also, in which first we check the temperature of the forehead, and then we check the temperature of the breast region. Then to check the severity of breast engorgement, because of signs and symptoms we have already understood that breast engorgement has taken place. So how to determine the severity, how severe is the condition, that we will come to know with the help of 6-point engorgement scale. This was developed by the scientist, and higher the score indicates more is the engorgement. So according to the signs and symptoms, we will decide if there is slight change, or if the breasts are firm and non-tender, if they are firm as well as tender, very very firm, very very tender. Based on that, the severity will be decided, and we will be deciding the treatment parameters. Another important aspect is patient education. In patient education, in during antenatal classes only, we are teaching it to the pregnant females, that which are the common problems faced in postnatal phase. So breast engorgement is one of the topics which we are already educating in antenatal classes. But if in case somebody is not aware, then we educate the patients about the physiology, how this breast engorgement takes place, what are the causative factors, what are the risk factors for that, how it can be treated, and what are the do's and don'ts done by the patient. Then in advice, we always advise a well-fitting bra, which should be providing support as well as comfort. So ideally, a maternity and nursing bra should have these parameters. It should be breathable. It shouldn't be too tight, so that heaviness will be felt in the chest. The mother should be able to feel the comfort. It should be stretchable, which will make the breathing easier. After that, it should be supportive, in which the sagginess of the breast will be prevented. And always wear a clean washed bra, which will have antibacterial properties. Like if same bra is used for days together, that may lead to, means there will be some collection of the milk, which is a good medium for the growth of bacteria. So always wear hygienic and bras which are pre-washed. Next treatment for engorgement is, before every breastfeed, apply a moist warm pack. So this moist warm pack is advisable before breastfeeding, and it aids in relaxation by increasing the blood supply over the breast region. For moist warm pack, either you can use hot water rubber bag, but it shouldn't be placed directly on the skin. So before that, you can place a towel or a handkerchief. Over that, you can place the hot water rubber bag. If hot water rubber bag is not available, simply you can use a towel or napkin. You can pour that napkin in hot water, squeeze it, and after squeezing, that moist heat can be applied over the breast region. Okay, so that will be helpful for letting down the milk reflex. Then frequent short feedings with every 2 hourly gap, and correct latch is important. Then this correct latching, you can see here how the baby should be placed for the latching. This is the ideal position in which he will be able to breathe properly through the nose. Then the areola will be there in the mouth of the baby, so that there will be proper sucking, and it will be helpful for baby to suck the right amount of milk. Then you can massage your breast to relieve the discomfort, but while massaging, you are not supposed to rub over the region. Massage should be with gentle strokes. For that, you can use a lubricant like whatever moisturizer or oil you are using, and in that you can use for every stroke you can perform 3 repetitions with the help of superficial stroking with fingertips. You can use web space of hand to perform clockwise and anti-clockwise massage. Or if you are not in a position to take a massage, your caregiver can provide you these kind of massage, but with gentle strokes. So that will be helpful for relaxation and relieving the discomfort of the mother. Next, if the baby is not able to suck the milk properly, or if your baby is done while feeding, if your baby sleeps and you still feel that there is a remaining amount of milk in the breast, so you are supposed to gently express the milk either manually. This is the technique in which you gently stroke over the breast and take out excess amount of milk. This milk can be stored for the baby, or if baby is done, you can just express the milk to prevent the engorgement. But in this, you have to be careful that you are not supposed to squeeze the breast को जो है हल्के हल्के दबा के जितना मिल्क बाहर आता है वो आपने बाहर निकाल के इधर आप स्टोर करके रख सकते हो. सिर्फ इसमें एक ये करना है कि अगर आप स्क्वीज करोगे ब्रेस्ट को, और ब्रेस्ट एंगोर्जमेंट में ब्रेस्ट ऑलरेडी हार्ड होते हैं, उसमें ऑलरेडी रेडनेस होता है और वो कड़क हो जाते हैं, तो वो दबा दबा के वहां पे दर्द बढ़ सकता है. तो उस केस में आपको हल्के से दबा दबा के मिल्क बाहर निकालना है. So at a single stroke, you should never try to express whole milk. After breastfeeding, what you can do, सी अगर ब्रेस्ट एंगोर्जमेंट ऑलरेडी है और उसमें भी आपने वार्म कंप्रेस देके मसाज करके बेबी को फीड कर दिया है, उसके बाद भी थोड़ा डिस्कम्फर्ट हो सकता है. तो ब्रेस्ट फीडिंग होने के बाद जब भी आपका बेबी सो जाता है, उसके बाद आप कोल्ड एप्लीकेशन लगा सकते हो. इन कोल्ड पैक्स यू कैन यूज द कोल्ड जेल पैक्स एज वेल एज एट होम. इफ दिस कोल्ड जेल पैक्स आर नॉट अवेलेबल, another advisable and cost effective thing is cabbage application. So cabbage के जो पत्ते हैं वो आप फ्रिज में रख के उनको कोल्ड करके यू कैन पुट दोज कैबेज लीव्स विद इन योर ब्रेसियर्स लाइक देम. If you can see in the picture, this is the position of cabbage leaves, how you put them over your breast, and this will be helpful for minimizing the tenderness over the breast. Or if you have this cold gel packs, they can also be used. In case you don't have them, you can just put a bottle inside the fridge, और वो cold water bottle जो है वो भी आप apply कर सकते हो. So ये आपको discomfort कम करने में मदद करेगा. And this can be applied for just 3 to 5 minutes, which will be helpful for relieving the discomfort. Now, if manual expression of milk is also troublesome, matlab sometimes expressing it manually may lead to pain, or you are not effectively able to manage it, then we can mechanize the thing by using breast pumps. So one type of breast pump is manual breast pump, which is very cost effective, which is easily available and cheaper option. तो इसमें जो है आपका ब्रेस्ट एकोमोडेट करके, इफ यू कैन सी हियर, यू कैन एकोमोडेट योर ब्रेस्ट एंड विद द हेल्प ऑफ दिस पंप यू कैन टेक आउट द मिल्क इन द बॉटल, और ये बॉटल में ही आप स्टोर कर सकते हो, एंड देन व्हेनेवर योर बेबी नीड्स यू कैन गिव द मिल्क। और अगर ये मैनुअल पंप भी डिफिकल्ट होता है, सो इन सम सेटअप्स, इन सम नर्सिंग होम्स और इन फिजियोथेरेपी सेटअप्स, इलेक्ट्रिक ब्रेस्ट पंप्स आर अवेलेबल। इन इलेक्ट्रिक ब्रेस्ट पंप वहां पे ऑप्शंस होते हैं जिसमें वैक्यूम जनरेट होती है और मसाजिंग इफेक्ट भी होता है। सो दिस हेल्प्स इन प्रॉपर एक्सप्रेशन ऑफ द मिल्क, जिसमें कंटिन्यूअस मसाजिंग इफेक्ट होके ब्रेस्ट को डिस्कम्फर्ट से भी छुटकारा मिलता है और मिल्क एक्सप्रेशन इजी हो जाता है। सो दिस इज bit expensive, but this can be helpful for relieving the engorgement. So either manual breast pump for home use, or if you are going to more sophisticated center where these kinds of things are available, you can go for electric breast feeding pump. In physiotherapy, we first advise these things. So if those things are not working, means that is not helping the patient to relieve with the symptoms of breast engorgement, we have a modality called therapeutic ultrasound. So this therapeutic ultrasound should be taken by the help of experts. ये आप घर पे नहीं ले सकते हो और ये घर पे एडवाइस भी नहीं किया जाता है. So if you are visiting any physiotherapist that you are having breast engorgement problem, the physiotherapist has properly assessed you, then this can be advised to the female. इसमें जो होता है, ये इसको ट्रांसड्यूसर कहा जाता है, अल्ट्रा थेरेपेटिक अल्ट्रासाउंड है ये ट्रीटमेंट पर्पस के लिए ही यूज होता है, और ये थेरेपेटिक अल्ट्रासाउंड ब्रेस्ट रीजन पे घुमाया जाता है. द ड्यूरेशन ऑफ दिस ट्रीटमेंट इज 5 minutes. The selected mode is pulsed mode, and the frequency will be 1 megahertz, and it will be applied on the 20% duty cycle with the intensity of 1 watts per cm square. So this has been proven with the help of researches that this 5 minutes of ultrasound on pulse mode is very effective in relieving the symptoms of breast engorgement. But this has to be done with the help of a physiotherapist. Then there are some exercises which are helpful for increasing the blood circulation and massaging effect over the muscles which are present over and near the chest region. So in that we advise these kind of exercises in which there will be pectoral stretching, which will be helpful for increasing the flexibility of the muscles of chest region, upper back region, neck region. So अगर वहाँ की flexibility increase होती है तो ये exercises करते वक्त वहाँ पे blood circulation बढ़ता है, और blood circulation बढ़ता है, उसके साथ साथ उसकी elasticity भी बढ़ती है, और वो मदर के लिए ज्यादा comfortable हो जाता है. Along with that we advise neck exercises. सो नेक एक्सरसाइजेस के साथ भी वो रीजन पे ब्लड सर्कुलेशन बढ़ने में मदद होती है. तो यहाँ पे हम लोग कुछ एक्सरसाइजेस देख सकते हैं in which you are supposed to forward bend the neck, you are supposed to take your neck backward, रोटेशंस करते हैं जो राइट साइड और लेफ्ट साइड नेक घुमा के आपको देखना है, साइड फ्लेक्शन में ले जा सकते हो. सो ऑल दीज काइंड ऑफ एक्सरसाइजेस, इन सम केसेस वी कैन एडवाइज शोल्डर मोबिलिटी एक्सरसाइजेस ऑल्सो. सो उसमें क्या होता है कि जब हम एक्सरसाइज करते हैं तो ब्लड सप्लाई हमारा वो एक्सरसाइजिंग मसल्स की तरफ बढ़ता है, जिसकी वजह से वो वहां पे वो मसल्स को ज्यादा ऑक्सीजन और फूड स्टफ्स मिलते हैं और वो एरिया इफेक्टिवली काम करता है और वहां से जो पेन वगैरह है वो कम हो जाता है. So this was about exercise and stretching. So in some cases, even if the symptoms are not relieved, the females are supposed to consult the obstetricians or lactation consultants are there, and there are some kinds of medication जिसमें पेन किलर मेडिकेशंस होते हैं, फॉर एग्जांपल आइबुप्रोफेन, सम ब्रोमोक्रिप्टिन टाइप ऑफ मेडिकेशन होते हैं जिससे आपको पेन रिलीफ होता है, या जिसमें हाइपर लैक्टेशन मतलब ज्यादा से ज्यादा मिल्क प्रोडक्शन होता है वो कंट्रोल करने के लिए कुछ दवाइयाँ होती है. बट दिस इज नॉट द राइट प्लेटफॉर्म टू शेयर द मेडिकेशंस. ये सिर्फ आपको कंसल्ट करके और एक्सपर्ट के एडवाइस से ही लेना है. और ज्यादातर केसेस में फिजियोथेरेपी और जो भी एडवाइसेस है, इफ यू फॉलो देम, इट इज वेरी वेल प्रिवेंटेड। और प्रिवेंशन के साथ साथ अगर आप बाकी सब भी करते हो तो ब्रेस्ट एंगोर्जमेंट से जरूर आपको राहत मिलती है। बट इन सम केसेस वेयर रिक्वायर्ड, यू शुड गो टू दी एक्सपर्ट्स, और एक्सपर्ट विल गिव यू द राइट ट्रीटमेंट, बिकॉज हर पेशेंट के हिसाब से ट्रीटमेंट अलग होती है, हर पेशेंट के हिसाब से किसी भी मेडिकेशन का डोज ये अलग अलग होता है। तो इस वजह से आपको कंसल्ट करना चाहिए। बट बिफोर दैट, एज वी हैव सीन, the things which are helpful are exercises and stretching, therapeutic ultrasound, breastfeeding with manual pumping, or electric pumps are also available, cold application जो फीडिंग के बाद किया जाता है, मसाज फॉर एक्सप्रेशन ऑफ द मिल्क, जहाँ पे जेंटल मसाज करना है लेकिन ब्रेस्ट को स्क्वीजिंग नहीं करनी है। देन फीडिंग के पहले डिस्कम्फर्ट रिलीव करने के लिए जेंटल मसाज करना है, 3 3 मिनट ईच स्ट्रोक। यू कैन सी ऑल द स्ट्रोकिंग मैन्यूअर्स, जिसमें आप फिंगर टिप से मसाज कर सकते हो, वेब स्पेस से मसाज कर सकते हो, पामर मसाज दे सकते हो। फ्रीक्वेंट एंड शॉर्ट फीडिंग विथ करेक्ट लैच, moist warm packs before giving the breastfeeding to the baby, and use of proper well fitting bra, but which shouldn't be too tight and which should be hygienic. So these are the easy, cost effective, and scientifically proven methods to prevent and treat breast engorgement. सो इफ मतलब जो भी फीमेल्स है वो अगर ये सब फॉलो करती है तो डेफिनेटली उनकी ब्रेस्ट एंगोर्जमेंट से उनको जल्दी राहत मिल सकती है। सो आई हैव अ क्विक रिव्यू ऑफ ऑल द स्लाइड्स। वार्म पैक्स, frequent feedings every 2 hourly feeding, gentle massage, manual expression of the milk, application of cold pack after feeding, then manual breast pump as well as electric breast pump, therapeutic ultrasound, exercises, और अगर इन सब से भी प्रॉब्लम नहीं छूटती है तो एक्सपर्ट एडवाइस लेके मेडिकेशंस। So this was about, even if this is a small topic, this is very very important, because अगर breast engorgement होती है तो breast feeding affect होता है, that may affect the baby's immune system as well, because breast milk is very very important for developing the immunity in the baby, and it is helpful for mother as well, as it was already explained by our previous speaker. So any questions are there? I am ready to answer them.
Yes, ma'am. Thank you so much. It was pleasure listening to you, ma'am, after so long. Thank you so
Thank you,
much for
ma'am.
your valuable inputs. Ma'am, there are certain questions that we may take.
Yes, please.
How to identify the difference between breast engorgement and hyperlactation?
ब्रेस्ट एंगोर्जमेंट के जैसे हमने साइंस डिस्कस किए हैं, वी हैव सीन दैट देयर आर swollen breast, there will be tenderness, and you will feel hardness in the breast. Hyperlactation is one of the cause of the breast engorgement. So hyperlactation होता है, and if there is imbalance between demand and supply, means baby is not demanding but there is supply of the milk, so that excessive supply of the milk is known as hyperlactation. So that will lead to breast engorgement.
Ma'am, the next question is there any difference between the breast engorgement and the inflammatory breast cancers? Because people get very much afraid about those signs and symptoms. So how not to mix up the symptoms between?
Yes, ma'am, definitely. Breast engorgement is usually seen within first week of postpartum period. मतलब डिलीवरी के फर्स्ट वीक में ही आपको, जब आपको लैक्टेशन स्टार्ट हो जाता है, मतलब आपको बेबी को ब्रेस्ट फीड करना है, और जैसे जैसे मिल्क सिक्रीशन होते जाता है तो आप आइडेंटिफाई करोगे ये सारे सिम्टम्स। और इन्फ्लेमेटरी ब्रेस्ट कैंसर के सिम्टम्स दोज कैन बी सीन इन मदर्स हु आर नॉट इन पोस्टपार्टम पीरियड एज वेल। उसके सिम्टम्स तो आपको इरिस्पेक्टिव ऑफ डिलीवरी भी दिख सकते हैं। एंड देयर आर अदर साइंस ऑफ इन्फ्लेमेटरी ब्रेस्ट कैंसर ऑल्सो, means this is a breast engorgement is an entity which is commonly seen in postpartum period only, but breast cancer can be seen in any phase of a female's life.
Okay. Yes, ma'am. And then the next question is, how do you diagnose breast engorgement? Do we have to visit the doctors every time, or is there any points that we need to take care, or we can self-assess that is one of the question, ma'am. The breast engorgement.
यस मैम. यूजुअली क्या होता है, सेल्फ असेसमेंट से भी ब्रेस्ट एंगोर्जमेंट डायग्नोज करना इजी हो जाता है. वी स्टार्ट आइडेंटिफाइंग दैट वी स्टार्ट फीलिंग हेवीनेस इन द ब्रेस्ट जब जब मिल्क सिक्रीशन होता है. सो वो हेवीनेस ग्रेजुअली मतलब यू फील दैट योर ब्रेस्ट हैव बिकम हार्ड. तो वो हार्डनेस ऐसे होता है कि हम लोग स्क्वीज नहीं कर पाते, और स्क्वीज करने की कोशिश करते तो टेंडरनेस होता है. और कॉमनली क्या होता है, ड्यूरिंग पोस्टनेटल पीरियड आफ्टर डिलीवरी, एनीवेज द फीमेल इज admitted for 5 to 8 days in the hospital. So within 3 to 4 days, if she is finding such signs, she can consult the medical caregiver, so that it will be confirmed if it is the breast engorgement or any other issue is there. But very well, a woman can identify the initial phase of the breast engorgement, and she can prevent further engorgement by following the suggestions which are given in the presentation.
Okay. The next question, ma'am. Yes. How to make aware about the mothers that how frequently this breast engorgements can take place? Is it throughout the period of this breastfeeding journey, or is it in the initial phases or in the initial months that they deliver after delivery?
गुड क्वेश्चन मैम. ये ब्रेस्ट एंगॉर्जमेंट जो है इनिशियल डेज में होता है, बिकॉज सी दिस लैक्टेशन इज ऑल्सो हार्मोनल. मतलब अपना ब्रेन जब सिग्नल देता है कि बेबी के लिए मिल्क सिक्रीट करना है, तो इनिशियली बेबी की डिमांड और अपने मतलब ब्रेस्ट से होने वाला मिल्क सप्लाई, इसका मिसमैच हो सकता है. तो धीरे धीरे जब मतलब बेबी सकिंग करना स्टार्ट करता है, हम लोग ब्रेस्ट फीडिंग एवरी 2 hourly स्टार्ट करते हैं, तो धीरे धीरे वो बैलेंस होते जाता है. सो दिस इज नॉट थ्रू आउट दी postnatal period a female can experience. It is initial first 1 or 2 weeks it will be there, but gradually it will be relieved.
Okay.
But in some cases it may happen that 3 months matlab till 3 months postnatal they may experience, 6 months postnatal, so in which the medical care will be required.
Okay. Ma'am, are there any devices that which are called as nipple shields or nipple caps that can be used, and how frequently it should be used?
Yeah, nipple shields are used, but once you experience the nipple cracks, that time you can, but as a preventive measure you are not supposed to use those things if the latching technique is proper. If means sometimes what happens, some females they are taking the baby in a wrong way, means position of the female as well as position of the baby is wrong, so baby starts sucking just the tip of the nipple, and in that bargain the pulling of nipple will leads to nipple cracking. तो वो अवॉइड करने के लिए अगर प्रॉपर लैचिंग है जिसमें एरियोला कवर हो रहा है निप्पल के साथ साथ, सो इन दैट केस निप्पल क्रैकिंग विल बी अवॉइडेड, एंड दैट विल बी मोर एडवाइजेबल टू प्रोड्यूस प्रॉपर लैक्टेशन.
Ma'am, the next question is like, does the patient or the client need a reference to visit the physiotherapist for this problem of breast engorgement?
No ma'am, surely if the lady identifies these kinds of symptoms are there, usually we are physiotherapists are a part of multidisciplinary team. So usually what happens is whenever the obstetrician finds out these things, he gives a referral to the physiotherapist, or a patient can directly report to the physiotherapist if she is experiencing such kind of symptoms. When we are already giving postnatal care, that time we are assessing the patient, but in case the patient identifies that before us, patient may report it directly to the physiotherapist.
Okay. Ma'am, then the further question is, there's a question in the chat box here, which is the best place in India to get training for the lactation consultant?
Best place, I personally I don't know the best place, but there are various universities which means which are giving this kind of course, but as a physiotherapist it is a part of our curriculum, so specifically I have not underwent such course. So,
Okay, ma'am, because these are the very common questions that get raised. Like, do you directly go to a lactation consultant, or do you visit a physiotherapist? Is that degree needed as a lactation consultant, or even a properly this thing acknowledged physiotherapist can also address the issue of breast engorgement?
ma'am, as a speciality means in women's health we are already dealing with such issues, so you can directly consult the physiotherapist, as I said, along with means consultation about lactation, we are also using some kinds of modalities. तो जैसे वो electric pumps है, those are available in physiotherapy setups. We are having therapeutic ultrasound. So therapeutic for that you need means a skilled person who is trained in using that kind of treatment modality, which is used for proper purpose of the patient. Means you should know the indications and contraindications in which patient you are supposed to use them. तो वो knowledge एक physiotherapist को होता है. So definitely a physiotherapist who is trained in women's health area can deal with such issues.
Okay, thank you, ma'am. Ma'am, also, how long does this breast engorgement take to recover? Like, how many sessions does the patient or the client need to visit or take the treatment at a physiotherapy clinic for breast engorgement?
Yeah, usually within a week it is cured. Means if it has already set in, it takes a week to cure the breast engorgement. But usually in PNC we are already preventing that. Means we are giving proper advices and we are able to prevent it. But in some cases, when they report with breast engorgement, within a week it will be cured.
Okay, perfectly fine, ma'am. Yes, ma'am. To this, I think we have taken all the questions that we have received online and through the chat box. Yes. As this has very much cleared with both the sessions that we have conducted today. Thank you so much, Dr. Manisha Rathi ma'am and Dr. Nupur Kulkarni ma'am, that we could have your valuable time over here with us at IFPWC from Latur district. Now, I would also thank to the participants, those who have been staying with us for last 1.5 to 2 hours. I would request if there are any participants who would like to convey your voice or any feedback for our today's sessions. You can raise your hand, we will unmute you and then you can speak up. We have a couple of participants, those who have raised hand. Yes, ma'am, I'm unmuting them. We'll start with Janvi Ladda. Okay. Janvi, you can talk now. Janvi, yeah.
Good afternoon. Myself Janvi Ladda. I am studying in Physiotherapy College Latur, final year. I would like to thank both Rathi ma'am and Kulkarni ma'am for educating us. And it has really helped me a lot to know about breast engorgement and breastfeeding. And I will and helped me to know about the different techniques that I can apply on my patients. Thank you so much, ma'am.
Thank you, Janvi. Now we have Shreya Chaudhary. You can speak now. You can give your feedback. Shreya, are we audible? You can unmute yourself now. Shreya, you have raised your hand. Would you like to? Yeah. Yes.
Good afternoon, ma'am. Myself Shreya Chaudhary. I'm final year physiotherapy student from Maharashtra Institute of Physiotherapy. I would like to thank Kulkarni ma'am for sharing their knowledge and introducing us with new technology such as breast pump. That was very good initiative, and I would like to study further about that. Thank you, ma'am, for sharing that knowledge.
Thank you, Shreya. We have one more hand raised. Deepika D'Souza ji. Yes, you can unmute now and you can speak your words. Thank you.
Hi, good evening, everyone. Thank you, Dr. Neha, for giving me mic. I would like to thank Dr. Manisha Rathi ma'am for wonderful session in this evening, and also Dr. Nupul Kulkarni ma'am. You know, both the session was so detailed information that really helping me. I'm a dietitian, so it will really help me in my profession as well. For counseling my patients who are coming for diet and nutrition for lactation and all. So really a very informative session. Thank you so much. Thank you, Neha ma'am.
Thank you, Deepika ji, for your wonderful feedback. We also have with us, I think Benveer ma'am has disconnected. She was there throughout the session. Okay. I would now like to extend my vote of thanks for today's session. Ma'am, you can, Nupur ma'am, you can stop your presentation.
Yeah.
Yes, ma'am. Yes, ma'am. Thank you. I would like to take this opportunity to address the vote of thanks for today's webinar series, which is the first webinar that we had to host for today evening. I would like to thank our IAP President, Dr. Sanjeev Jha sir. I would like also to extend my thanks to our IAP Women's Cell National Head, Dr. Ruchi Varshne ma'am. I would like to thank IAP Women's Cell West Zonal Head, Dr. Pooja Kamble ma'am. I would like to thank IAP Women's Cell Maharashtra State Coordinator, Dr. Suvarna Ganvi ma'am, Joint Coordinator, Dr. Snehal Patel ma'am, then Sub-Coordinator, Dr. Uttara, Dr. Nirali Sangvi, and Dr. Priya Karande. Thank you so much, all of you, for making this webinar happen successfully today evening. I would also like to extend my thanks to Dr. Vinod Kaushik sir, who is one of my colleagues in helping us with the IAP digital media team. Along with the entire team, it was possible for us to host this webinar continuously without any interruption. Ma'am, Nupur ma'am and Rati ma'am, if you could give your valuable feedbacks for any upcoming webinars, that because this is the first series of webinar that we have started for this month, and we had conducted this webinar in keeping in mind the breastfeeding week awareness that was from 1st to 7th of August. So this Saturday that we have taken these two webinars, and the following Saturday that we will be having a webinar on mother's nutrition during lactation. That will be taken up by Mrs. Deepika D'Souza ji. And then following that, we will be having one more webinar on 31st of August. That is again a Saturday. The timing remains same from 3 to 5 p.m. That would be our guest speaker for that webinar is Dr. Priyanka Bhange ma'am. And the topic would be as we also have our World Physiotherapy Day celebration in the upcoming next month. So the topic would be low back pain, that is generalized from pediatric to geriatric, how a physiotherapist can help it for dealing that. So ma'am, yes, Rati ma'am and Nupur ma'am, if you could give your valuable feedback for today, I hand over the mic to you. Thank you.
Dr. Neha and your team, I congratulate you all because it was really a wonderfully organized. Even small tips were given on time, so that this should organize in a very planned and very nice manner and well executed also. So wonderful session you people have organized, and Dr. Nupur also very nicely explained about breast engorgement. So I think this type of webinar series will definitely help students as well as general community to understand the basic problems, which is very common in nowadays, and they will definitely take some message from these webinar series and will benefit the community. Okay, so wonderful initiative you people have taken up.
Yes,
So
thank you.
all the best for next sessions also.
Thank you, ma'am. Thank you so much. Yes, ma'am. Nupur ma'am, you can have your words.
I would like to thank the organizing team. It was really a very well planned session. And I really appreciate the efforts taken by whole IIP Women's Cell, that you are creating awareness in general public as well, because so far for professionals it was definitely helpful, but you have started including the target populations who will be benefited by such webinars. In suggestions I would like to give that some kinds of conditions which are means some like in antenatal period, low back pain is commonest complaint, but along with that they have varicose vein, round ligament pain, sacroiliac dysfunction, or pubic symphysis dysfunction, which is casually taken by females as a part of normal physiological process, but which may lead to some discomforts in postnatal periods. So if you can cover such topics also, and if you can include, as today you have included the general population as well, so that will be helpful for creating awareness among them, and
Thank
that you can do. So
Yes,
just a
ma'am, for
suggestion.
your valuable suggestion and feedback. We will definitely look into that. Ma'am, we have certain, thank you. I think attendees have a message. Thank you so much for, this is message from Amita Agarwal. Thank you so much for the wonderful session. Both faculties have shared a great knowledgeable session. Thank you, Amita. Then we have message from Kavita Ramesh. Thank you so much. Looking forward to have more webinars in future. Surely, Kavita, we will be posting the IAP WC webinars over the IAP WC Instagram page and all the social media page that we have mentioned. And along with that, you can also subscribe our channel at IAP YouTube, where you will keep on getting the updates. And then we have Bhakti Kardile. Thank you so much, Nupur ma'am, for the guidance you have shared. Thank you, Bhakti. Then we have one more from Chalappan. How to get the next webinar details and link. We will be sharing this over the different groups. We will also be posting it on the social media. So I would request you to keep updated or follow us on our social media platforms. Like you can follow on IAP, or else you can also follow on IAP WC Women's Cell Team at Facebook, Twitter, Instagram, LinkedIn, etc. Thank you so much. This is message from Pradnya Khemna. Thank you so much. Nupur ma'am is always our favorite. Yes, ma'am. Thank you so much, ma'am. And thank you all the participants for your all valuable feedback. Sheetal ma'am, thank you so much for staying all long, and we could complete first of our series webinar. Thank you so much, everyone. And yes, today we are also supporting the Indian Medical Association for to raise their voice against those who are too afraid to speak out. Like there is this a rail which is going on, which condemns all the violence on the female doctors in Kolkata that is going around. So that is one of the message that the IMA team has been passing, and IAP has been supporting them throughout for this. Thank you so much, IMA, and thank you so much, IAP platform, for giving us this valuable webinar to be hosted for today. Thank you once and all. Thank you, everyone. Have a great evening. Thank you, ma'am.
Thank you.